All the speaking valves that are currently on the market are flapper type speaking valves. These have a flapper membrane that folds inward upon inhalation, allowing air to go into the trachea and the lungs. And then upon exhalation, the flapper membrane closes 100%, redirecting the air superiorly towards the vocal cord and allowing speech. The most common type of flapper valve on the market is the Passemeer valve. The Shikani speaking valve is a different kind of valve. It has a ball type design, whereby a ball is sitting inside the cylinder, which has a frontal opening. The ball moves posteriorly upon inhalation, allowing air to go into the trachea. And upon exhalation, the ball moves forward towards the frontal opening, closing the opening and redirecting the air superiorly towards the vocal cord and allowing speech. The Shikani speaking valve has several unique features. It offers an adaptable and dynamic two-way mode of use design, the 6 o'clock position and the 12 o'clock position, which allow the tracheotomy patient total control of the valve and a more functional airway. It comes in two colors: clear for outpatient use, which is discreet and barely visible, and blue for hospital use, so that the patient can find it quickly in case it is lost in bed. This diagram shows the inside of the valve. It has a cage with a 2.5-degree ramp, which when the valve is placed in the down position or 6 o'clock position, the ball rolls readily forward towards the frontal opening, closing the opening and redirecting the air. In this 6 o'clock position, which the patient can determine by feeling the notch at 6 o'clock, is also called the notch down or bias closed mode, allows a positive closure, which is used for continuous speech or for eating and swallowing. The cage has two vertical ramps in the back, which prevents the ball from falling into the trachea upon inhalation. When the valve is rolled superiorly, placed in the 12 o'clock position or notch up or bias open mode, the ball sits in the back of the valve, allowing a stress-free continuous breathing in and out through the valve and at will speaking. The Shikani speaking valve has several unique features. The patient favor the valve over the flapper valves because of its lower airflow resistance. This is particularly important for the pediatric patient and the elderly patient with borderline pulmonary reserves. The valve is easier to tolerate and associated with much less fatigue and more wind power as compared to the flapper valves. Another major advantage is that when placed in the 12 o'clock position, the valve allows a stress-free and much easier first-time introduction by the speech-language pathologist as compared to the flapper valve, which saves significant time to the SLP and significant anxiety to the patient. Patients also like the fact that the Shikani speaking valve is more discreet, smaller in size, with a lower visual profile than the flapper valves. Indeed, the front diameter of the Shikani valve is less than 15 millimeter versus 20 millimeter for the Passimier valve. This is due to the fact that the flapper valves have to be larger to allow a thin membrane to be able to fold inside the valve, a requirement which is not needed for the ball that moves in and out the cylinder. An in vitro assessment of the Shikani speaking valve functionality was done using a pneumotachometer or a test lung machine in order to measure airflow versus pressure drop, which is a measure of resistance. This was a multi-institutional collaboration between the MedStar Union Memorial Hospital at Baltimore, the NIH, and the VA hospital in Southern Florida. The Shikani speaking valve was compared to the Passimier flapper valve in the pneumotachometer. The piston simulates inhalation when it moves to the right and simulates exhalation when it moves to the left. The test subject is the speaking valve, and the pressure transducer measures the subglottic pressure. The study was published in the American Journal of Speech and Language Pathology in 2015. This graph shows the result of the airflow resistance measuring pressure versus flow. The green line on the graph shows the competitive Passimier flapper valve, the blue the Shikani speaking valve in the 6 o'clock position, and the red Shikani speaking valve in the 12 o'clock position. We note that in the flow rates of normal breathing or light day activity of the trach patient, which go between 0.08 liter per second and 0.33 liter per second, there was a statistically significant lower airway resistance associated with the Shikani speaking valve, both in the 6 o'clock and the 12 o'clock position, as compared to the competitive Passimier flapper valve. A multi-factor analysis of variance was done, and it shows a highly statistically significant difference in airway resistance in favor of the Shikani speaking valve at 12 o'clock as compared to the Passimier valve with P less than 0.001. There's a marked difference with the Shikani speaking valve in favor of the Shikani speaking valve when it's placed at 6 o'clock, although this was not statistically significant, and there was no difference between the Shikani speaking valve and the 6 and 12 o'clock positions. Another study was done comparing clinically 3 different types of speaking valve: the Shiley flapper valve, the Passimier flapper valve, and Shikani ball valve. This was done in collaboration with Dr. Dietrich Burns, who's currently at the NIH. The results show a highly statistically significant improvement with P less than 0.001 in olfaction and speech naturalness in favor of the Shikani speaking valve over the Shiley and the Passimier. On the right, you can see the percentage improvement, the Shikani over the Shiley and the Shikani over the Passimier for olfaction and speech naturalness, which is highly significant with a star on it. The other general speech parameters showed an improvement in favor of the Shikani speaking valve, although it was not statistically significant. The parameters that were assessed were maximum phonation, SZ ratio, jitter, noise, turbulence, and voice intensity. The oxygen saturation showed no difference between the three valves, at baseline 15 minutes and 30 minutes. An analysis of variance shows a highly significant improvement in olfaction and restoration of smell in favor of the Shikani speaking valve as compared to the Shiley speaking valve, which is number 1. The Passy-Muir speaking valve is number 2 on the graph. Same was noted with speech naturalness, highly statistically significant improvement in favor of the Shikani speaking valve, which is number 3 on the graph, versus Shiley and Passy-Muir, number 1 and number 2. Summarizes the study where the Shikani speaking valve demonstrated the highly statistically significant advantage in speech naturalness and olfaction, and general superiority in all speech parameters. In addition, 80% of the patients who were studied preferred the Shikani speaking valve over the flapper valve, mainly because of the ease of breathing and the fact that the Shikani valve was small and discreet. And also, they liked the fact that there was no honking or fluttering of the Shikani speaking valve, which is observed with the membrane of the flapper valves. All insurance companies cover the Shikani speaking valve. It's the same code, HCPCS, code L8501, which is the same for all tracheotomy speaking valves on the market. Medicare covers all these valves every 3 months, and most private payers cover them every 2 months. The Shikani speaking valve can be effectively cleaned with hydrogen peroxide, contact lens solution, or even soap and water. It is recommended to clean it every day. It is also recommended to change the valve to a new valve every 2 to 3 months to avoid biofilm, which can cause infection. This is recommended to all speaking valves. In summary, here are the benefits of the Shikani speaking valves. Like all speaking valves, the benefits include restoration of speech and communication, improvement in swallowing, improvement in olfaction, reduction in pulmonary aspiration, facilitation of secretion management, reducing pulmonary infections, saving costs to the healthcare system. But the unique advantages of the Shikani speaking valve over the flapper valves include an adaptable and dynamic design, two-way mode of use, 6 and 12 o'clock, lower airway resistance, which make it much easier to breathe for the tracheotomy patient, more discreet and smaller size, which make it more appealing and more comfortable, a significantly superior olfaction, significantly superior speech naturalness, generally superior speech parameters, and a voice quality that lasts longer throughout the lifetime of the valve without any honking, which is typically seen with the aging flapper membrane. Change is ahead, change is good. Technology is moving from the old traditional flapper valve to the newer ball valves, which have many advantages. Shikani speaking valve is manufactured in the United States by the Airway Company.